I want to talk a little bit about special populations. What are some key considerations for things like lipid management in patients with chronic kidney disease or those on dialysis?
So, for patients who are on dialysis or who have CKD, I pretty much treat the renal disease as a cardiovascular risk factor. And in my opinion, I think that those folks should be aggressively uh, managed for their LDL cholesterol, and we should really try to get the numbers less than 70, if not less than 55, for their LDL.
Mhm. And in patients with HIV, inflammatory diseases, or things like cancer receiving targeted therapies, how do you individualize lipid management given drug interactions and competing risks?
Right. So statins can often interfere with um, the antiretroviral therapies for patients with HIV. And the effect is such that the statin level is increased. And so that can increase your risk for myopathies. For those patients, the medication that should be prescribed, the statin that should be prescribed for patients with HIV is pitavastatin. And I don't prescribe it often, but I for patients with HIV, that should be the one that we are prescribing.
Mhm. And let's talk a little bit about kind of future directions in research specifically. There's a growing interest in this, what could be potentially a one and done or long acting lipid therapy, including things like gene editing. I've heard a lot about CRISPR, for example. How do you see these fitting into future treatment landscapes?
That's a really great question. I think that the future is very bright when it comes to CRISPR and Cas9 therapies. I'm a health equity researcher, and so I try to be practical. What role will these medications play in my patient population? I'm not quite sure. We've got a lot of room to improve on lifestyle modification, on making sure that people have access to healthy foods, to making sure that medications that are actually generic are actually affordable. And so the gene editing therapies, I think, have a lot of promise, but it just seeing how it plays out clinically, we still have a long way to go, especially as it relates to equitable care.